Continuing on with task 13, we're just going to go ahead and take our slide and put it onto our microscope. So over here I have the slide that we have already stained and we dried for a little bit, and we're going to put it onto our stage of the microscope. We're locked and loaded, and I'm going to go ahead, turn on the light, take a seat, and we're going to take a peek and see what cells we see on the microscope. Okay. So we're going to start on the 4x objective lens, because that's the lens that you want to start at, just to get a little focused on your slide. And I'm going to basically start on the left hand side of where my smear is, which looks like it's right there. So we're going to go ahead, we're going to raise up the stage until I get a better view, which is right there. We're just going to focus a little bit. Make it wider for my eyes. We'll fine tune it a little bit. Alright, so I'm nice and focused right now, so we're going to go ahead and we're going to start by switching over to the 10x objective lens, and we're just going to look all over our slide for right now just to see what cells we might be seeing. And along the way I'll be using my fine focus on my left hand side just to see my cells a little bit better. And then this one I'll go from left to right, and then right to left, and so on and so forth. And again, we're starting on the 10x objective lens. So far I'm just seeing a bunch of epithelial cells. Couple of parabasal cells so far. Pretty small parabasal cells, nothing too crazy. Couple of other little small artifacts. Alright, that's the end of the smear, so we're just going to go up, and then we're going to go from right to left. Again, so far all I've really seen are parabasal cells, a couple of little intermediate cells. So now we're going to go from right to left. Still see some more parabasal cells. Just more parabasal cells. Have not seen any bacteria or red blood cells or white blood cells. Alright, and then that's the end, so we're just going to go up, and then again we're going to go from left to right. Just more epithelial cells and parabasal cells. Couple intermediate cells right there. So far nothing too concerning. That's the end right there, so we're going to go up, and this is going to be my last strip, going from right to left on the 10x power lens. Again, just see more parabasal cells. More parabasal cells. And then that's the end. So now what I'm going to do is I'm going to go back to my starting position of the lower left. Just make sure, let's see my cells, bottom left, which is going to be right here. And now what we're going to do is we're going to switch it over to the 40 times lens just to see them a little more detailed and see if we see anything differently with this lens. And again, we're just going to turn up our light just a smidge, and then we're just going to fine tune. Okay. And again, we're going to start from left to right, and then we'll go up a little bit, right to left. Just make sure we're covering every aspect of our slide just to make sure that we see everything. Again, so far what I've seen on the 10 times setting has just been a bunch of parabasal cells and intermediate cells. So I'm going to continue on with the 40 times power lens and see if I see anything else. Again, light just needs to get turned up just a smidge. And we'll fine tune a little bit. Alright, and we will continue on. So we're going to go from left to right. Actually, I'm going to turn the light back down just a smidge. Alright. And again, so far I've just been seeing mostly parabasal cells, even under my 40 times 10 lens now. Couple of intermediate cells. Alright, so that's the end of my smear right there. So we're just going to go up a little bit, and then we're going to be going from right to left. And if in this section, if when I go from right to left all the way over, if all I'm seeing are more parabasal and intermediate cells, I'm going to go ahead, put on my immersion oil, which is in my container right here, and switch it over to the 100 times lens just to get a better view. Just fine tuning a little bit. Alright, and then we're going to go from right to left. Again, all I'm seeing are parabasal cells, and I've seen a couple intermediate cells right there. More parabasal cells. Still not seeing any bacteria or any white blood cells or any red blood cells or anything else. Strictly just still seeing parabasal cells with some intermediate cells. And it looks like that's the end of my smear. Oh, one more, hold on. Alright, so that looks the end of my smear right there, my bad. So now, since I'm only really seeing parabasal cells and intermediate cells, I'm going to switch my lens. It's going to be in between the 40 times lens and the 100 times lens. And what I'm going to do is just put one drop of my immersion oil that I have right here. Because when we look at our 100 times power lens, we want to make sure that's our oil immersion lens. So we want to make sure we have a drop of our oil on the slide as well. So again, I just need one drop. Okay, we're going to switch it over to the 100 times magnification lens. And I'm going to turn up the light just a little bit. We're going to use my other lens to focus. And then we're going to go ahead and just look around a little bit with our immersion oil. And so far, I'm still just seeing parabasal cells. I'm going to turn down the light just a smidge. Again, just seeing some intermediate cells with a bunch of parabasal cells. They're stained very well, so I see them nice and clear, but still not seeing any cells other than those couple. So then we're just going to go up, and then this is going to be my last section of going from right to left on the 100 times power. Still just seeing parabasal cells. Couple of intermediate cells right there. Fine tune a little bit right there. Just another parabasal cell. Okay, and that's the end of my smear. So I'm going to go ahead, I'm going to turn off the light. I'm just going to lower the stage of the microscope away. We're going to take our slide, throw it into the sharps container because we're all done with it. And then you want to take a Kim wipe and just make sure that you gently clean the oil off of the 100 times lens. And then we're just going to switch it over to the 4 times lens and move the stage over a little bit just so that it is ready for use for whoever needs to use it next. And we're going to take our microscope, push it back a little bit. Putting the immersion oil back over here, and then we're just going to move the camera a little bit this way and straighten you up a little bit, and we're just gonna have a little discussion. I'm gonna hold up a couple of pictures that I found that I really like, just to go over some of the cells that are seen on vaginal smears typically, and also just of going over the estrus cycle. All right, I think we're in a good plane, so I'm just gonna take off my goggles, take off my gloves since we're done with that part. So the first picture that I printed out that I really like, sorry, just move you a smidge more. You're on top of the counter. Okay. So I printed out this one that I really like. Feel that it explains really well just all the cells that you typically see during the estrus cycle of a female canine. So over here you have your anestrus stage. So typically you're going to see a bunch of parabasal cells and small intermediate cells. Okay, moving on to your proestrus stage, which is the next stage, you can start seeing some red blood cells, some neutrophils over here. You'll see some larger intermediate cells. And then as proestrus cycle is continuing on, when you get to your late proestrus stage, you'll start seeing anuclear superficial cells or some nucleated superficial cells. So has a nucleus, does not have a nucleus. And you see superficial intermediate cells as well. Going into the estrus cycle over here, you know, you'll start seeing more cornified cells, which are just the large superficial cells, and you'll start seeing them in clusters. And then finally into the last stage, which is your diestrus cell over here, you often see, you know, more of your reappearance of some of the intermediate and the basal cells that you saw in the beginning at the anestrus stage, and you know, your superficial cells kind of disappear a little bit. So I felt that that was a good printout to show just the different type of cells that we'll see on a vaginal smear on our canine friend. Okay, and then moving on, another printout that I really found that I like is a little more of a microscope view of the cells that you'll see of the estrus cycle of a canine. So again, over here in your anestrus stage, which is about 2 months out, down here you're going to see a bunch of intermediate cells and parabasal cells kind of clumped together. Again, the parabasal are going to be some of the smaller cells seen on your anestrus cycle. They're kind of round with usually a big nucleus compared to a very small cell body. Okay, and then moving on over to your proestrus stage in here, which is about 9 days out, you're going to start seeing some red blood cells, some neutrophils, some bacteria can be seen at this point as well. You'll start seeing intermediate cells, which are going to vary in size and structure. They don't really have a distinctive shape to them. Moving on to when you start to ovulate into the estrus cycle, which is going to be the part where the female canine is most fertile and is going to reproduce to get pregnant. You're going to see very large superficial cells. At this point, you're going to see they start getting cornified, and they'll be clumped into sections where they don't really have a nucleus anymore. They come and they look pretty flat at this point as well. And then after the estrus cycle, you go into your diestrus stage, which is, you're going to start seeing less and less of the superficial cells, and you're going to then enter your diestrus stage, which is going to be the reappearance of intermediate cells and the parabasal cells that we saw, or that we'll see more in the anestrus stage as well. Based on my cytology on the slide that I just looked at, I just saw a bunch of parabasal cells with some intermediate cells, so I'm going to go ahead and say that my friend that I took my sample on today was in the anestrus part of the estrus cycle. So again, that is going over just some cells that are seen in a canine vaginal smear, and that is my conclusion of task 13, which is just collecting, preparing, and evaluating a canine vaginal smear.